Dr. Steve Biko Okoth. I'm a consultant physician at the Kakamega County General Teaching and Referral Hospital. This is a hospital in Western Kenya, and it is a public hospital serving the larger population of Kakamega County and its environs, with a catchment population of around 4 million people, including the surroundings, and an attendant population of around 5 to 600,000 people being served directly by the hospital. Yeah, so I undertook the course in Respiratory Medicine, as part of the Merck Foundation scholarships that was in the University of South Wales. So I undertook it up to the level of Masters and completed the Masters with distinction actually in 2021. So my overall experience with the course in Respiratory Medicine was actually very good. This course was an eye-opener, though largely an academic program, but it exposed us to a wide array of issues dealing with respiratory health, both in our country and even within our environs itself. It enabled me to see a lot of things that I've been encountering from another perspective. And because largely it's an online course, so you do most of the reading yourself and interact with the faculty online. I had to basically bridge a lot of the coursework with the practical aspects, as I was continuing on with my work at the county hospital. The course faculty largely comprised of very good teachers, although I never met them physically, but even through the online interaction, they managed to pass quite a lot to me. So my course essentially had two arms. One, the technical arm, the postgraduate diploma, and then the master's. So upon completion of the master's program, courtesy of the Merck Foundation, my fund of knowledge in respiratory health actually has greatly improved. Now, this has enabled me to achieve a lot of things. One, I began this course while the COVID pandemic was still on. That is the postgraduate diploma. And in my interaction with the COVID patients, especially the critically ill ones in the ICU, we were able to offer a higher level of care, handling things like, for example, complications like ARDS better, oxygen management and device management, in a better way, handling like the intubated patients in a much better way, handling other comorbidities that were accompanying these diseases in a much better way. The course also enabled me to have a very good understanding of lung health, and that put me in an instrumental position to advise our hospital and the county on issues relating to better approaches to handling COVID as a disease entity. Now, the benefits of the course actually extended beyond COVID, and they have enabled me to improve on care of our patients with pneumonia. And actually, there are some studies that we are currently running in the hospital. For example, we are doing a pragmatic study looking at the role of steroids in terms of management of patients with pneumonia. So it's a multi-facility study, not only being done here, but using the knowledge I gained from the course, I've been much able to participate actively in this particular venture. Now, the other aspect that the course has helped me with is asthma care. Asthma care through the Respiratory Society of Kenya, that is RESOC. Basically, we have been able to set up asthma booths with a drug company, And these booths have been stationed at 3 strategic points in the hospital. That is in the adult ward, in the pediatric ward, and in the outpatient casualty. And they have offered ready access to nebulizers and nebulization as a method of managing asthma amongst our population. This has reduced greatly morbidity for these disease entities. Now, the other thing that we are handling is, of course, better care for our TB patients. We have an active TB clinic in the hospital, and it's basically government supported in terms of medication and personnel. But from the knowledge gained in the course, I've been more able to interact with our TB team and offer better service. Because as you are aware, TB is a problem in Africa, but it does not exist by itself. It exists with other problems. So the knowledge gained has enabled me to tackle the multifaceted approach or approaches that TB is expressing itself here. And finally, we actually, through the course, are in the process of improving on the care of our lung cancer patients, and even patients with interstitial lung diseases and other diseases requiring direct interrogation of the lungs. We have acquired a bronchoscope in the hospital. We are in the process of training through the Respiratory Society of Kenya and the Kenyatta National Hospital, which is our main referral point in Kenya. So we are building capacity because this is an activity that requires many people. We need nurses involved, we need therapists involved, myself. So we are building capacity, and hopefully in the next few months we should be able to start this as a diagnostic intervention for our lung cancer patients and any other patient who needs a bronchoscopy as a service. Now, if that happens, then this is going to be the first time that has happened in the western part of Kenya. So just as I mentioned, from the exposure in the course, that is Respiratory Medicine at the University of South Wales, courtesy of the Merck Foundation, as a doctor, a physician in this region, my technical knowledge on lung diseases has greatly improved. And the impact of this has been seen, one, directly in clinical practice, where we successfully set up, COVID treatment and isolation centers. Number two, introduction and sensitization on other aspects of lung health, that is asthma care, even TB itself. Improvement of lung diseases in our inpatient population and outpatient populations, and even setting up of referral systems that have actually helped not only us, but even facilities around us. Then also the exposure to the course itself has helped, because I interact with the students. We have a university here that has got a medical training component. So it has helped me, during my interaction with the students, and even helped, taking them through lung and lung-related issues. Actually, I have made several referrals to the Merck Foundation, for my colleagues, and I've basically tried to encourage them to apply for the lung health component or respiratory medicine component, largely because, one, there are very few respiratory specialists in Kenya. Counting the number is actually less than 50. And this is a big country and there are big needs. Many of these specialists are concentrated in urban areas. In these rural setups where we work, you don't have a lot of respiratory health people. So I've actually impressed upon my colleagues to pick up the same. I've also impressed upon them to pick up other courses being offered by the Merck Foundation. And we have been fortunate to get some of them on board. So I just want to thank the Merck Foundation for this initiative. It is actually a game changer in terms of how information is disseminated. The knowledge part is disseminated largely through the online programs. Of course, we need also to look at the practical aspects, because medicine is something that it's more like mentorship. You need sometimes to have someone to apply whatever you have learned. That one is being worked on. In Kenya, we have the Respiratory Society of Kenya, which has been very close to the Merck Foundation, and they are working on ways of bridging this. And this is even part of, like some of the bronchoscopy trainings we are having, spirometry trainings, air quality management trainings, even conferences, on lung health, both in Kenya and outside, courtesy of the same. So to me, what I'd urge is that that linkage just needs to be strengthened, and it needs to be more synergistic in such a way that we bridge, trainees from the knowledge aspect, that is the book aspect, to the practical aspect of the same.